Hey, it's good. They're being safe. All right. Hi, everyone. Well, I see people still sort of coming into the room. Welcome. My name is Chris Johnson. I'm the Director of Communications for the Georgia Mental Health Consumer Network. And I am joined today by a number of friends who I'm going to let introduce themselves, friends and allies and colleagues, and friends to be. And we are really glad to be here for our third webinar discussing 988. In our first two sections, which I believe the first one is online now, the second one will be coming online soon. If you want to catch up with us afterwards. We discussed who we call and who shows up when we dial 988. Today we're going to be talking about where we go. What are the places that we go to? Where do we end up as a result of calling 988? And what does that look like in different communities around the state? And what does that look like for us as peers? We are going to start today with some introductions for everyone. Like I said, Chris Johnson, Director of Communications, Georgia Mental Health Consumer Network, and a person in long-term mental health recovery. And I am joined today by, I will pass it to, why don't we start with Mahogany as our featured guest. And just tell us who you are.
All right, my name is Mahogany Ellis. I am a crisis coordinator with the Department of Behavioral Health and Developmental Disabilities. And just a little bit about what we do in our office. We oversee our crisis system. So all of our crisis units, we oversee those as well as the implementation and continued rollout of 988.
Awesome, thank you. Jean Olszewski.
Sir, reporting for duty. Good afternoon, everyone. Jean Olszewski, CPS and CARES, Director of Recovery and Advocacy for the Georgia Collaborative ASO, also Caroline Behavioral Health. You might recognize the name Beacon. We used to be Beacon, but we are now Caroline Behavioral Health. And we support all our peers in Georgia through 988 and our partner GCAL, the Georgia Crisis and Access Line. And on behalf of DBHDD, we're thrilled to be able to offer 988 follow-up as well. So we do outreach calls to our peers or individuals or their allies who may have called for mental health support, behavioral health support, and we reach out to them if they were not taken into a hospital situation or something of that nature. So we just make sure they have resources, if they're in need of anything else, and make those connections for them if they need them. We also do the 988 text and chat on behalf of DBHDD. So thrilled to be here.
Thank you, Jean. We are thrilled to have you. And let's see who else we have here. Kelly.
Hey, y'all. Hey, I'm Kelly Blanton. I am working with Georgia Mental Health Consumer Network. I am the director of the respite centers. And so we support 988 by using our resources, our services that we have, which is the respite center, the warm lines, and the daily wellness activities. So.
Awesome. Thank you. And Heather, would you like to say hello?
Hello, everybody. My name is Heather James. I am the Chief Training and Development Officer for Georgia Mental Health Consumer Network. And within my role, I support 988 just within the training functions of our GMHC and employees. I work hand in hand with Kelly and her respite center staff and their warm lines.
Awesome. Thank you all for being here. We will go ahead and just get started, but because we always like to start with something, we like that strengths-based approach, lead with strength, right? What's going well with 988 so far that you've seen from your perspective as a citizen, your perspective as someone doing this work? What's working well with 988 that you've seen in your work or your community? Jean, you want to go?
Sure, thanks. One thing that I'm thrilled to see is more awareness. So people are becoming aware of 988 and what it offers. You know, I think on one of these last sessions, we had somebody say that, or somebody said that it was, I saw a poster or at a shopping center. You know, I'm seeing so many different advocacy groups and schools. You know, during our last legislative session, it was on, you know, everybody was talking about 988 and how to support that. So I love seeing that the word is getting out there. That if you do have a mental health or behavioral health crisis, to call 988. So that's great to see. From a personal perspective, what we're the 988 follow-up that we've been live, I think 2.5 weeks now. We've already had some situations and callers that we've been able to support with connecting them to life-saving services. So that's what we're here for, you know, because a crisis doesn't really, you know, it just doesn't stop, right? It's a continuum that we are constantly hoping to provide resources and growth and education and comfort. So I'm really thrilled about that.
Awesome. That's great to hear. Jean, Mahogany, how about from your perspective? What's going well?
I mean, I definitely would agree with Jean. Just the awareness is something that it continues to grow. And I think because of the awareness, people are really talking about mental health, right? It's not as taboo as it has been in the past. And, you know, specifically for, you know, the Black community, that is something, right, that is very taboo. So to be able to have these conversations of understanding mental health, and not just understanding it, but know that there's resources in some places you can go and not feel, you know, that you're going to be 1013 or, right, just a safe space. I think it's something that is very needed for the communities that we serve, those high-risk populations. So I think that's the best piece that's really going well. Just, again, to piggy off Jean, the awareness and understanding, just a data point, when we first kind of started 988, which, you know, we're going into, this is year 2, we're about to have our 2nd birthday. The growth of 988 is now at about 30% of people actually making the call to 988. In Georgia, we've always had the GCAL number, but now people are utilizing the 988 number because of the awareness of it. So I think that number that percentage of people actually calling 988 will continue to grow. But I think that's just one evidence of the number is really, the awareness is really getting out there for 988.
Awesome. That's great to hear. Kelly, how about you from where you sit? What's working well? 988.
I think too, just the stigma, just being able to talk about it, you know, the numbers out there, it's available and people are utilizing it. And I think it's a really great, you know, a great thing to have, you know. So yeah, just the stigma, just people talking about it and having, you know, having a number they can call and get the support that they need, and then get transferred to the warm lines if need be, or, you know, come into the center. So yeah.
Awesome. Yeah, that's great. Thank you all.
Hey, Chris, can I dip in on that? Just the awareness.
Sure.
I just remembered I'm going to a baseball game May 27th. I'm going to go see the Braves. Wow, that's great, Jean. Thanks for sharing. Well, also,
why are you going on that night, Jean?
Oh, good one, Chris, because it is 988 awareness night at the Braves game, May 27th. It's a Wednesday, and DBHCD Commissioner Tanner will be throwing out the first pitch. So, talking about awareness, everyone loves their baseball.
That's fantastic. Do we
Chris,
know?
can I jump in on this one real quick too? I'm sorry. I think another really great thing with awareness, if anybody is like me, a Grey's Anatomy fan in Station 19, they weren't on last week, but the week before, they talked about some heavy stuff. And at the end, it was all about 988. And if you are someone in crisis, or if you need somebody, or if you know somebody, to reach out to 988. So I thought that was great that it's getting that national coverage now.
Yeah, that's fantastic. I think, you know, tying some of those threads together, you know, the Georgia Mental Health Consumer Network was part of a informal kind of coalition a few years ago that it was the Fulton FC3, we called ourselves, the Fulton County Crisis Coalition. And we looked at community responses. Like, we went out and talked to people in the community in Fulton County. What happens in a behavioral health crisis? Who do you call? Where do you go? And the one thing we learned is that of the many resources available to people in Fulton County, the one that no one we talked to utilized was 911, right? They would not call because they knew the outcomes, the potential outcomes that might result from that. And that wasn't, they wanted care and support, like not arrest. So we worked really hard to understand the data that we were collecting and, presented that to some folks. And now, as a couple of years later, we are preparing to provide services at the new Fulton County Crisis Center, and as part of the living room model, where we're going to be providing peer support to folks showing up there. And can I tell you, it's so wonderful to me that at the same time we have this 988 number that people are going to be able to call to get referred there. Because if we were still relying on 911, I know from our experience with the Fulton Crisis Coalition that people wouldn't be able to utilize it because they wouldn't know about it. Now, when they call, they're going to get a different response and a better response, we hope, from the folks that are going to be at the new Fulton County Crisis Center. So it's exciting for us to be a part of all that. And Jean, I think that you touched on a piece without elaborating on it too much, but the whole continuum of care and how 988 can connect you with that. It's not just about the crisis, right? It's like they call in shipping the bergy bits from icebergs. It's not just the big berg, right? It's like all the little bergs on the way that can like send you into a crisis situation. So just so much great stuff happening. But as a background to all of that, I wanted to talk a little bit, and we're not going to go into it too much because we don't have that much time, but I wanted to talk about just, where people go. One of the primary things about people getting well and staying well with their mental health, their behavioral health altogether is just having a place to go, having a place to be, right? We all know from our sort of psychology 101 or wherever we pick this stuff up that, place to feel safe is, a foundation for being well. The hierarchy of needs, we're like way down here, you got to have it. And a lot of people don't. And in Georgia, it's been that way for a long time. And it's actually getting increasingly worse. I pulled up some data and I was going to share it with you all, but I don't know that I have the technical ability to do that. I think I have the authorization. I don't know if I personally have the talent to do it. But there was an article in Bloomberg a couple of years ago. Here, I'll just drop this in the chat because why not? It said, why Metro Atlanta is the poster child for the US housing crisis. And it talks about all the things that sort of the perfect storm of the housing crisis, not just in Atlanta. I mean, it focuses on Metro Atlanta, but it talks about Georgia as a whole. And, looking back, it's not just a new thing because Atlanta is this hot new place to live. Apparently, since 1958, there's been a steady increase, not just in Georgia, but in the whole Southeast of the region covered by the Southeast Mental Health Technology Transfer Center. All of us as individual states in a region have been increasing in population more than the US overall since the 1950s. People are continuing to move from places like South Dakota and Idaho and places where it's very cold to here, where life is generally more pleasant from at least a temperate standpoint. And that increased with the pandemic, and it's going to continue increasing for a while, as far as anyone can tell. And we have, there's only so much we can do. As peers, I can't build housing, right? That's not my lane. Some of you may be able to build houses that are on the call with us here today. But I think a big part of, something we don't really talk about is how many people their first behavioral health crisis is a result of housing instability, right? Especially children. We know from the ACEs study that came out a while back, we know how much of an impact that has and how much of an impact is that lack of housing having on our population in general. I know we have some great folks over at the department, Mr. Ruppersberg, who is is there anything he can't do? No, there's not. is working so hard to move us forward on the issue of housing. But I just wanted to ask a couple questions of you all. And if you don't have answers, that's fine. I know we're not housing specialists, but just as a place to go, I think where our callers are calling from is so important as to what the outcome of that call might be. So I wanted to ask you all, do you know, like what percentage of your calls like can be traced back to a root cause that's related to housing stability or homelessness? Like Jean, do you have any idea?
I don't have specific data that is a 988 cause effect directly correlated to housing instability. I have anecdotal, you know, hopefully we'll be able to gather some data regarding that. Because that's part of the social determinants of health or social drivers of health, which we are, you know, it's on everybody's radar now. Because as you said, housing, you know, that starts the waterfall or can start the waterfall. So we are, as I said, we've been up 2.5 weeks. So I do have the anecdotal, but hopefully we'll be able to come back in a year and a half and say, yes, this is directly related to housing instability, you know, rent challenges. I know that in the legislative session, again, that was on everybody's radar. A lot of advocates were fighting for rent stability. Especially as it related to COVID, because we know so many people were evicted from COVID and lost their jobs, weren't able to pay their rent, affected the, you know, children. So it is a cycle, it's a circle effect, but it is on people's radar. And again, there's things being done proactively towards that. Do I have 1 in 3 callers are reporting housing instability? Not yet, but I hope to be able to make that correlation. I don't know if Mahogany has something that's directly related.
I don't. So one of the things about 988 when an individual calls, well, one, you know, they don't have to give us any data, right? So they don't have to share their name, their age, or anything like that. The reason why they're calling is not something that we actively track. But I will say we are very well aware that social determinants of health is a key, you know, factor in trying to make sure that individuals that do call us don't stay in crises. And so we have created trainings that help therapists, peers, physicians, everybody, right, really understand the importance of social determinants of health and to really ask the important questions, utilizing like screeners and things like that, those things to help determine what's the root cause of why this individual is in crisis. And to Chris's point, when you talk about Maslow's hierarchy of needs, right, if I'm worried about a roof over my head, right, I'm not worried about this depression and all of that stuff is not the priority for me to continue outpatient or do those things. And so understanding that better when individuals come through crisis will allow kind of the case management and discharge team to really work with the individual to determine the appropriate next steps. But yeah, so in regards to just tracking that, it's hard for us to give real factual data because everybody that calls doesn't share the information with us, which I think is a plus to know for individuals who are calling to know, you know, that information you don't have to share. And so it's hard to really give that hard, concrete data because of that fact.
Right. And that's one of the main, like, we're so important, Mahogany, about 988 and calling is that you're not going to, you know, give your social security number and this and that and everything else. And, you know, your mother's maiden name and all that. And that's one of the things about follow-up is it's more conversational. Usually people aren't in crisis. We're just calling to follow up to see, did you receive the resources you needed? Well, I don't know. I'm still homeless. Oh, you know, so it's a conversation driver.
Yeah, and I mean, honestly, sometimes I know when I was in my 20s and was experiencing housing instability in New York, right? I was like, we were all unstable in our 20s in New York. You know, we moved there with no money and, you know, it felt like anxiety and stress. It didn't feel like I was experiencing anything other than what everyone else was experiencing, but I was, you
Mhm.
know, but I didn't have the, wasn't self-awareness. It was like awareness of like what all this is. There was no, I have adverse childhood experience that, that wasn't a part of my reality at that point in time. I just knew I was in pain. Right. And so, I don't know that callers calling up would know even to say, yeah, I'm experiencing this as a result of this, how would they?
That's a good point, Chris. But I think that's we talked that first question of the awareness of 988 and people talking
Mhm.
about mental health now and having a better understanding of what that is, instead of just coping with it and not realizing, right, that this is something bigger. I think that's one of the best parts about this is people being able to have the conversations and realize like, oh, this is anxiety, or oh, this is what depression looks like, because it can take so many different shapes and forms. And so having those conversations, I think, is really key.
Absolutely. Absolutely. Kelly, how about you? I mean, just like based on the calls that you've taken, that you listen, that you report on, well, how many are dealing with or stem from home housing instability, would you say?
Yeah, I don't really have a number on that, but it is a pretty good bit. Like, a lot of concerns do stem from not having housing, and not knowing where they're gonna go. And so yeah, it's a concern, not having housing. And so we just offer the resources that we have we have available, and we support our peers with coming into the center and helping them fill out for housing applications. So we just support peers. But yeah, a lot of them do call and they have housing, but they don't actually say it because, like you said, like it's not, when you're going through those emotions and going through those issues and challenges, it's not something that you really say because that's not the what it feels like you're going through right then and there, I guess is a good way to say it. But yeah, I don't have any numbers on it. I just know that it is a factor for sure.
Right. Okay, so it sounds like you guys help folks fill out applications. Like if someone's calling 988 or GCAL, if they say, I need housing, like, they're straight up, they know that they need it. They're just trying to get it anywhere they can, because from my conversations with folks in the community, folks are asking everywhere. Like, it's not just GCAL, it's like Wendy's, where can I get a place to stay? Folks, are challenged in that way. Do you have like an official response, or depending on the community they're in, do you have resources that you can connect them to, or how does that, what does that response look like now? Like Mahogany or Jean?
Yeah, I was gonna say, I mean, definitely we are equipping our GCAL team, our 988 response team, of resources available. We utilize, of course, all of the resources that we have with DBHDD. We try to connect those individuals to the right region, so that way that region can help, right? Because one thing we know is region to region, what that looks like is totally different. And so to pretend that we know what goes on in Metro Atlanta is not the same thing that goes on down in rural Georgia, Southern Georgia, right? And so understanding that landscape is totally different. So we try to connect those individuals to the right team, department to help them access those resources in that region. I know within our crisis system, we tell all of our agencies, make sure you fill out the Georgia housing voucher for those individuals that are homeless. And if you filled it out last time, do it again this time, right? Because it might have been a piece that was missing, or that didn't get processed, and now that individual is there. Like if there's extra questions that need to be asked, like we do it again, because it's always something that we can capture it. We definitely want to try. But I think, again, it's about knowing the resources and giving the individual the resources that are available, that's region specific, and being able to point, to the RSAs or the field offices about additional help and support for housing needs as well. Because again, every individual, that looks different too, depending on what's going on with them. So it's hard to, act like every situation is the same. There's a lot of nuances to that, whether you have kids, you have special needs, right? All of those different things. There's a lot of different variables. And so there's a lot, just connecting the people to the right departments, I think is key. And I think our 988 operators are prepared for that.
Yeah, and that's, I'm going to build on that just a little bit, Mahogany, because that's very accurate. And 988 is it's a crisis. It's a crisis call, right? So you're again, use your metaphor, Chris, we're talking at the tip of the iceberg. Here's some of the most common resources, and we do break it down by region. We break it down by county, trying to support the needs that they have, knowing the nuances of it, as Mahogany said. Maybe there's kids involved, maybe they want to stay in the same school district, or somebody's elderly, so a pet, right. So we're always trying to, and maybe somebody's looking for housing, but they don't want to go to the shelters, so it's starting that process. And we can also talk about the Georgia Supportive Housing Voucher Program. We have a team at the ASO from our care coordination team who goes in inpatient facilities and helps start that process. And we're able to meet one-on-one. I go in with the team a couple times a month and meet with somebody one-on-one and really talk to them about it, because I think that's important too, to be able to have that face-to-face, because talking on the phone, you're in crisis. You may not have called because you don't have a home or you didn't realize that, but there's a lot of stuff going on in your head, and you're trying to make sense of it all and figure out your priorities, and take down resources and where to start, so I think the more points of contact that somebody can have, the better. Calling the warm lines, because they're going to be able to offer that maybe not the same resources, but people start picking up on, wow, there are things out there, but it's a collaboration, a partnership.
Okay, so we had a question in the chat that I'm going to put out there for whoever can answer it. It's not me. How do you see issues of housing access and instability impacting your service users funneling into residential treatment spaces or other inpatient spaces?
Well, I think if I'm hearing the question right, I think that's something we already see of people utilizing crisis services more so for beds versus the actual need. And again, I go back to really asking the questions and doing like a thorough assessment or interview to really get to the root cause of knowing what that is. So that way people who are in need of housing are not taking advantage of the beds that we need for those who are really in crisis, right? And so it's about, I think part of the way we address that is how we engage with the clients that come through the doors, and make sure that we are a pleasant, good attitude, that we want to engage with, somebody we want to engage with, and asking the questions about what's going on to determine if this is a true crisis or if this is a housing issue. And if it is a housing issue, how do we give them the resources that they need? So that way they're not utilizing the beds that are there for the people who are actually in crisis.
And I'm going to build on that just a little bit, Mahogany, because I'm seeing it when it says residential treatment spaces, I'm hearing more from a substance use side, because historically that's more with the nomenclature, and we do see a lot of long-term 6 months residential treatment from that end, in combination with outpatient care at a local CSB perhaps, or and I say that because on behalf of the state, our quality team does reviews of the residential treatment homes, So I'm seeing more of that than on the strictly mental health side. But of course, that's the beauty of the Pierce Sport Wellness and Respite Centers as well, to be able to offer, respite, which I have to say that was my first job here in Georgia, was working at the Decatur Pierce Sport Wellness Center, which was a wonderful introduction into the warmth and peer support here in Georgia.
Awesome. Thank you for that shout out. We always appreciate that, Jean. The I was going to say that in reference to the stigma piece, there are no open questions. I think I saw a question pop up though. There was how many states are using 988? I believe there is 988 representation in every state. Hence the title of the series, 988 in every state, because I was surprised to learn that as well, because I knew that there were 200 different departments or 911 offices around the country that were participating, but I was surprised that all 50 states were actually participating, but there's at least one municipality in every state that's participating. But yeah, the stigma piece that continues to Mahogany, backing up to something you said just a few minutes ago, when I tell people about 988, the response is different than it would have been just 5 years ago, because I think one of the things that happened, at least with like people I know in South Georgia, which is where I'm from, and I go down and I talk about this stuff, is that everyone saw someone during the pandemic experience some sort of behavioral health thing, right? And most people did not have a ready resource. And now, like when you tell them about this and you say, oh yeah, no, and you explain 988, they get very excited about it. They want to hear more about it. They want to know about it, which like 5 years ago, they probably wouldn't have had any interest because they don't know anyone like that, right? And now they do. Well, they all knew me, so there's that. But just from a bigger picture standpoint, I think things have shifted. Things definitely have shifted. But let's see, moving on. Where are we? At the end of a typical call that you have, how many get referred to some place, whether it's and when I say referred, I mean like an informal referral, even just a recommendation, a suggestion, like here, we're going to put this out there. This might work well for you, whether it's a respite center or a hospitalization outpatient, whatever. If it's a place that you're recommend folks go to, like how many calls do you think that is? Because I know some of our respite centers like mostly like talk to people where they are, right? And like it's definitely not a goal to get them anywhere. But like but still occasionally like people will need to talk to someone different, like to talk to 988, to talk to GCal. Kelly, can you tell us like how many calls, or do you even track that? I don't know.
Well, we don't really track it. But we are there to, to problem solve and come up with a plan and then, just support them where they are and the needs that they have. So that looks different for lots of people. It may be come into the center and let's see what resources that we have available. Let me look something up online for you. What location are you in? So it just looks different for lots of different people, but definitely just having a resource, something for them to go with, that always makes you feel better in the end. So we just try to come up with whatever area they're in, try to support them. I know I've got online plenty of times on a warm line call, and what location are you in? And then I go to work, and support them with that. So yeah.
Awesome. Jean, any idea? And I mean, I feel bad asking you folks for this data that doesn't exist, and I apologize for that. I'm just like, as I've been thinking about this over the past few weeks, I've come up with all these ways, like, what's happening? I'm sorry. Go ahead, Jean.
So I'm putting. I just put something in the chat to. Somebody asked about geolocating of 988. So I'll explain that top crisis now in a second. But as far as the variety of referrals, it's really hopefully getting to know and having a conversation and getting to know somebody a little better. Because again, you know, if somebody calls in crisis, they're going to say, I need help now. You know, it's immediate. It may not result in, you know, emergency services or anything of that nature, but it may be just having that calming voice that says, wow, okay, I'm glad you called. What's the biggest thing that's happening right now? You know, how can I support you the most? A lot of times it's for family members too. People are seeking, you know, or allies, their neighbors, you know, they're seeking help and information to support others. So we're trying to build on that and really do that outreach with them. Again, every single call, you're encouraged to continue to call back if you need to, you know, to 988, 911, whatever it may be. And also we give the warm lines. You know, we're trying to address the most pressing need, and then hopefully again that waterfall will just continue. So I'm just going to go back to that in the chat. Somebody asked about the implementation of geolocating, which is basically, you know, a lot of us, including myself, have an out-of-state phone number. So if I was to call 988 or 911 for that matter, or I'm sorry, 988, it would show up as I live in the Michigan area. So Crisis Jam, which DBHD has been on several times, many times actually throughout the last 2 years, I think it's been around Mahogany, is a national organization funded by SAMHSA that is all 50 states and a plethora of information and current information and always and very recovery focused and peer focused, and talking about and we'll have debates. You know, originally it was there should be no geolocating because then you may be tracking, you know, minority communities or something of that nature. So it's a very rich area for information. But to answer that question directly, obviously I can't. but that's the information.
Well, I will add, because something that recently I had to find it back in my emails and stuff, but the FCC voted to advance the geo routing recently. So like there's work that is happening in the background to make this a possibility for 988 to have that geo routing. I think that's why it's important for us in Georgia, because we are lucky enough that we've had the Georgia Crisis 800 number in place for over a decade, whereas a lot of states just have 988. So we in Georgia have the ability that if you want to ensure that you are getting routed to our Georgia 988 call center, you can call the 800 Crisis and Georgia Crisis and Access line to ensure that you're going to get routed there. I do think this is something in the future is going to happen. It's just, I didn't even know there was all of this kind of conversation and debating that needed to happen for this to be a part of 988, but the conversations are being had. So I think that's a step in the right direction.
And it's still a work in progress with 911 as well.
Yeah.
There's still parts of Georgia where you're like, I don't want to like quiet zones where you're in between towers and all that. And there's parts of the United States that are still implementing 911 after 10 years, I think.
And I have a follow-up question with that, and you might not know the answer. But I think this is more with like cell phone technology, where if I call 911 and I get disconnected or whatnot, or even if it's a pocket dial, I can set up something on my cell phone where it allows them to call me back. Is that an option that they might be discussing within some of these forums with 988?
I think so. I mean, I think those are kind of to emulate what 911 currently does. I think that will be, those are the conversations of 988. And I'll just add too that we're in a situation where 911 needs to be dispatched immediately if an individual calls 988. There is a process in place for us to be patched into 911 to make sure that we can find locations and get to the individual, as soon as possible if there is an active rescue that's needed. So I don't want people to feel like, oh, they won't know where I'm at. So we do have some options for those active rescue situations where we need to have 911 go out immediately to help someone as well.
That is good to know. Yeah, the technical piece of it is so baffling to me. I didn't take that class, the ham radio class in high school. I didn't have it, and I don't understand how those things work, but I'm glad they do. And I'm glad I'm not on the committees that are talking about them, except this one, which I love. So looking at thinking more broadly, because I want everyone to have a chance to talk about the resources that you and the people you work with have to offer. What is it when a 988 caller shows up at the stoop of a threshold that your organization provides? Why can they get there? And I guess we will start. Jean, you don't really have a stoop at your organization, do you? So why don't we go with Mahogany?
Well, I don't have a stoop either, but I think one of the things for our crisis units, right? They are equipped with the resources in their community. We have also kind of partnered with Find Help Georgia as a resource as well, resource tool to find resources, in your community as well. That if you don't know, that's a place to go. But all of our agencies know that they can always contact the regional field offices to also assist with placement and housing and to address those needs. So I don't have that stoop, but there are plenty of resources out there available for individuals. It's just connecting to the right place.
Mahogany, the BHCCs have a stoop, don't they?
They do have a stoop. They do.
Behavioral Heights. And there's 5 of them? How many are there now in the that's probably out of your lane.
It's so hard for me to keep up with all of them to know off the top of my head, but yeah, we do have a handful out there now.
And Jean, do you want to tell people what those are?
Excuse me, the behavioral health
crisis center?
Crisis center?
No, is it crisis? I don't know if we're coordinating. I don't know if crisis is in there. BHCC. So it's a model that has been around for a couple of years that DBHDD with funding from the government, because SAMHSA has determined that this is a great way for more people to receive services. It's another way to get open doors and more doors open, talking about stoops, where you can show up and the door is not going to be closed. So if you need help, the door is open and they will support you right then and there. And it's behavioral health. I could be probably Googling this as I'm looking because or speaking, but behavioral health crisis center. Yeah.
Okay.
But there is a behavioral health coordinating council too, and that's why I was a little confused. But it is behavioral health crisis centers.
Thank you, Jean. Kelly, you've talked a little bit about what happens at the centers, but I think one thing that there may be some folks on here who don't know what peer support is. You talked about providing peer support. Could you talk a little bit about what that looks like and feels like versus other sorts of treatment or helping folks might receive in other places?
Yeah, sure. But we do have a stoop. We have 5 stoops throughout the state of Georgia. So yeah. So what it looks like when a peer comes and they need peer support. So all the staff are certified peer specialists, and that just means that they have a live life experience. And so a lot of people can connect through that mutuality. So if you're going through some challenges, a lot of times the staff, the peer staff that you're talking with has been through it or can relate to you. So you just find that connection and you support them. We do the wellness activities, WAM, RAP, we have DTR, Y'all Recovery. We do art exploration. We have computers that we can support you with filling out any kind of applications, housing applications, employment applications. So we're just peers there to support you with whatever challenges that you're going through at the moment, whether it be the housing or anything like that. So yeah, we're there to support you where you are. And so that's what peer support looks like. We're just certified peer specialists. And so we're there to listen and support and validate and empathize. So that's it. Did I
Awesome.
answer your question?
You did. You did.
Good.
Now, I know in the past, and this, I guess, is going back to Mahogany, the when we would call, when I worked at Community Service Board and we needed to know, like we got someone in a call from another region, like we could just call GCal and they could tell us like if there was a bed open somewhere or if there was room for someone in IOP in this other county or something, you know, whatever it was, they could help us determine access, hence the name, you know, Crisis and Access Line. Is 988 serving that same purpose, or are those features separated out in some way?
Those features are separate out, just because again, 988 is a national number. Everybody, right? If you have a out-of-state number, you're probably going to get transferred to a out-of-state 988 call center. And
Okay.
so if you do need that, again, that Georgia support, calling the Georgia and Crisis and Access line is going to be the way to know what's going on and how to get, Georgia, we have a bed board. So we know how many beds are available throughout the whole state, and that is routed through GCal.
Yeah, that bed board is important. People don't understand what an important role that bed board plays in the lives of so many people. Not just people receiving care, but people providing it, right? I mean,
we talk about our bed board as our air traffic control, right? This is the system that we use to help direct, know what's going on throughout the state. And so thank you for putting that in there. I was going to. So yeah, our bed board system is very important. We are continuously trying to upgrade it, find better ways to utilize it, to monitor, to, get data out of the bed board. But it's key for us. It's key for DBHDD providers, our private hospitals, everybody. It's very important for anybody that services the uninsured or underinsured. It's key for us.
awesome.
And also, Chris, just to make that differentiation, calling the Georgia Crisis and Access Line, you may need a crisis bed or to go inpatient more so than calling 988. So 988 is not connected because it's not an assumption that you're automatically going to need to be receiving inpatient services.
Can you talk a little more about that?
So like you said earlier, when you were working at a provider, the providers can use GCal and the bed board to find out somebody shows up at their door. They may be full, but they can say, hey, I've got, Chris is here. He'd like to stay in this area. Are there any beds available? So we can assist him in getting there. 988 is more pinpoint focused, if you will, where somebody, maybe it's suicidal or expressing suicidal, it's life-threatening. So that would be you're going to be taken most likely, or not taken, I shouldn't say that. The services that are going to be supporting you are those that are immediate in that area, most likely an ER and then to a CSU or something of that nature. But the majority of 988 calls do not result in active rescue. It's resources, it's support, it's referrals, but not necessarily to where is there an open bed for an inpatient facility.
Okay. Awesome.
Yeah,
Thank you
I'll
for
add
making that
to
clarification. Yeah, go ahead.
Chris on we have data points on the 988ga.org website as well. And one of the things that we track is someone to call, someone to respond, and somewhere to go. And right now we're seeing maybe about 60% of those calls end either in the someone to call or someone to respond. So 60% of the calls that come into Georgia for 988 or through the GCAL is resulting in a lower level of care. And I think that's because of the resources that we do have in place and the knowledgeable staff that are working at this 988 know how to connect people to those resources. So the goal is to continue have that number go increase unless people are going to the somewhere to go. But that information is on the 988ga.org website, and I'll also put that in the chat as well.
And Mahogany, that builds also on education and stigma reduction, because as people are becoming more familiar and hopeful and knowledgeable that it's okay to feel anxiety or depression, and to reach out for help for it. And to talk about it, talk about it at church, at your neighbors or what have you, as opposed to waiting until it is a crisis. People, and I think that's a great life-saving of importance.
Yeah, absolutely. Absolutely. And conversations like this one, right? Just making sure people know how to access services and what services there are. It's such a sea change in just like our communities, prospective communities around the state. And I think it's going to get better from here. It's just going to get better as more people become more aware. And that's where we like to leave these webinars, is on a hopeful note. And I think I heard lots of great stuff here today, but I want to hear finally as we go out, what keeps you hopeful doing this work? What motivated you to get out of bed and go to work today besides a paycheck, right? What got you to do this work today? Kelly,
I was going to say, for me, it is, I work off of the notion that I save lives. And so every day that's my motivation, to know every little thing that I do working behind the scenes of this behavioral health continuum is saving a life. And so that's what motivates me. Awesome.
Thank you. Kelly, how about you?
Yeah, I think for myself, it's knowing that I made a difference. That I've maybe, that I left somebody better than they was, that I was there to support them. Having what I wished I would have had when I was going through my mental health challenges, being that person. That's what keeps me hopeful. Thank you.
Thanks. Jean, how about you?
Feeds my ego. I get to help people, and it's an honor and a privilege when people aren't at their best. To be able to, as Kelly has said, to be able to use, my lived experience to hopefully make a difference in somebody's life, in a family's life, in a community's life. To have these forums, these conversations, to have the people participating in them, it's an honor. It truly, truly is.
Yeah. Thank you, Jean. I agree. Not about your ego, but about doing this work. It really
Come on, Chris.
It's we have a little sticker over at the network that we made a while back that says, "Be the person you needed most." And I think we're doing that every day. You know, we are making the changes we wanted, that we needed as peers, you know, when we were out there. And I'm honored to be here today with you all. For those of you on the call who came for continuing education credit, and there are almost always a few of you, please make sure that you fill out the GIPRA survey that was dropped into chat earlier. That is the way that the Southeast Mental Health Technology Transfer Center, which is housed at the Rollins School of Public Health at Emory University, can provide you that certificate. It comes automatically. So, and it doesn't come automatically if you don't fill out the GIPRA, and they can't generate one. So please, 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 if you came for continuing education, fill that out. And thank you all for being here at Mahogany. It's been such a pleasure getting to know you a little better. Jean, thank you as ever. Kelly, good to see you. Heather, did you want to throw anything in? What keeps you hopeful?
No, I've said it before, but I mean, it's just the fact that we can continue to just do this work and support each other and collaborate is what keeps me hope. Because I know no matter like where I'm in, what type of bind I'm in, if I don't know the information, that there's someone I can reach out who is willing to share and help. And that keeps me hopeful.
Awesome. Thank you so much, Heather. All right, everyone, we're going to wrap it here. Thank you so much for being here, and we look forward to seeing you next time. Be well.